eClinic Manager is a web-based, fully integrated online clinic management and virtual consultation platform which enables healthcare organizations to conduct video and telephone consultations, as well as manage face-to-face appointments from a single consolidated platform. We offer compelling value at every step in the process, from scheduling, patient communication, waiting room management, remote consultation, and attendance outcomes. Our goal is to deliver convenient care that improves outcomes, boosts staff productivity, and operational efficiency. TPRO is designed to integrate with any PAS or EPR system, which provides healthcare organizations with a closed loop solution, allowing healthcare organizations to streamline the virtual consultation process and remove manual inefficiencies from the workflow, allowing staff to focus on what matters most, patient care. End user access is validated by secure username and password. TPR also integrates with a number of single sign-on services, including Imprivata and Active Directory, which enables staff to automatically log in and not have to remember yet another password. Developed with accessibility in mind, eClinic Manager is extremely simple and easy to use for healthcare professionals and patients. Apart from internet access, all users need is a web browser on a computer or mobile device and a web camera and a headset or speakers. The first step in the workflow automatically schedules video, telephone, and/or face-to-face appointments directly from PAS or EPR, which are clearly identified by each icon. Alternatively, users can simply use their direct invite feature to schedule an appointment manually and, for example, instantly connect with an urgent patient who can't attend in person. Appointments are color-coded. That is, scheduled appointments are colored blue, while those in red signify the appointment was not attended by a patient. Green, meanwhile, notifies staff that the patient is in the waiting room, and finally, orange indicates when the consultation is in session. In some healthcare organizations, the welcome desk serves two purposes. Firstly, to register the patient and check demographics. Secondly, to route the patient to the correct waiting room. TPRO can recreate this, however, with our proven experience integrating with PAS or EPR, the patient is automatically routed to the correct waiting room. The receptionist or admin for the clinic can register patients as normal, but also manage mixed modal clinics, that is, telephone, video, and/or face-to-face appointments. Like healthcare professionals, they too can also communicate with the patient using video, telephone, or live chat functionality. Patients can then be routed or returned to the waiting room that allows users to replicate real life or real world in-person attendance workflows in the virtual environment. All users of the system have access to the patient lookup feature, which can be found in each user's profile. This tool can be used to search for and confirm patient demographics. Patients are sent a one-time secure invitation link via email or SMS. If preferred, TPRO can also integrate with third-party patient communication platforms to redirect the video URL link so that the patient receives invites for all appointments from a single SMS provider. To access their appointment, it's a single one-click access with no software or app to download. Patients can connect using any browser using their smartphone, laptop, or tablet. The patient is also sent a guide which provides clear instructions and step-by-step information on how to prepare for a virtual consultation. All video, telephone, and face-to-face appointments are indexed and searchable using multiple filters, including patient name, MRN, national health identifier, as well as by date and time. Users can also select from a drop-down menu, which will display a list of patients by clinic or by direct invite. Healthcare professionals can also check if demographics have been verified by a receptionist in the last attending column. Healthcare professionals are given the flexibility to either conduct the virtual exam using either video or telephone consultation, whichever is most appropriate. They have the essential resources they need prior to and during the virtual exam, with access to booking notes as well as contextually appropriate patient records. eClinic Manager supports video calls for up to 50 participants, allowing healthcare professionals, patients, as well as family members or interpreters to be on a video call at once. When joining a video session, the clinician has the option to admit one user or patient at a time, or they can admit all. In this case, there's just one patient, Jacqueline Smith, who will be attending today's virtual exam. So I'm just going to admit her. During the virtual exam, we give clinicians access to all required functionality, in addition to using this in-app chat function as an alternative or additional form of communication. As you can see, I can track any previous or correspondence or chat function previously entered into this waiting room or virtual exam. I also have the ability to add any attachments which can be shared with the patient. These can include self-help or PDFs, as well as video or URL links. As a clinician or the administrator of this call, I have the option to request a snapshot and or add or remove users from the session. Additionally, users or clinicians can avail of additional functionalities such as the option to blur background, which can be enabled or disabled. I also have the option to share my entire screen, and this can be used, for example, to show patient a set of or x-rays. You can also return back to the previous tab here as well. Finally, TBRA also gives users access to closed captioning. This can be used for patients or any other participants who are hard of hearing. Once enabled, it will then transcribe or provide a real-time transcript of what's being dictated, including speaker diarization. So can you tell me about the pain you've been realizing in your knee the past couple of weeks? Once the call has ended, the clinician has the option to return the patient back to the waiting room, thereby replicating real-life or in-person attendances. Clinicians can also refer the patient back to another consultant or clinician for further review or examination. In this case, once I click End the session, I'll then be prompted to select or choose from this outcome list, which are pre-configured for each and every specialty, and then click Save. Now the video call has ended. Healthcare professionals are then prompted to choose from a pre-configured outcome list as mentioned. They also have the option to add any relevant notes. So if I want to, for example, add an accompanying note here to say that the patient needs to be booked in for an MRI scan. ECM also gives healthcare organizations the option to view the session history, where you can record and store session information, photos, and annotations for further analysis. This is coupled with the benefits of a full audit trail of every virtual session created on the system to help meet and manage compliance. Following the consultation, the patient can also be sent a survey to provide feedback on their experience of attending a video consultation. This is a short, optional survey, and all responses are anonymized. eClinic Manager is positively received by patients, with 98% of survey participants reporting that they would either definitely or probably use the system again were they to be offered the option. TPRO also provides a live analytics dashboard of appointment activity from user, clinic, department, or healthcare organization. Your healthcare organization can collect, track, analyze, and generate attendance reports on your virtual consultations in real time. Management will be able to produce standard reports to monitor activity at various levels, i.e. department or to an individual level. As a minimum, reports include the number of consultations or sessions attended, as well as activity by user, waiting area, or activity.